Hi, my name is Greg McKettrick, a pharmacist with the Stanley Pharma Group. I'm here today to discuss and explain how to introduce the Stanley Penile Rehabilitation Protocol to your patient population. The first thing I want to mention to you is if your practice has primarily been as just a fulfillment center, just filling prescriptions, this will be a bit of a mindset change. We're looking at more of a consultative pharmacy, expanding your services and again, kind of building your business by getting out of just the fulfillment mindset. And once you have that in mind, understand the protocol. Very important. You need to be an expert on all points. How do you identify a patient? So, in your patient population, you'll have patients who present with erectile dysfunction, with urinary incontinence. Some are at a satisfactory level, some are struggling. These are the patients that you really want to focus on. One of the services that we use is a very comprehensive men's sexual wellness intake form. This gives us a great history on the patient, their background, what treatments they've tried in the past, what was the cause of their initial encounters with ED. Was it progressive or was it due to a surgical intervention? By understanding these things, you will have a better pathway on how to work with that patient. Another great way of introducing patients to the protocol is actually using our training materials. Many patients will visit our website. They will see the training videos, whether that be for oral ED medications, sublingual injectables, or our devices, like the vacuum pump or auto-injector. And at that point, they'll approach you to say, I'm really interested in learning more about this. Once you have the patient identified, explain to them exactly what the protocol is. Explain that it is a comprehensive, step-by-step path. Improving their circulatory function, physical therapy, exercises, medication therapy, all done in a building block mentality as we're starting from the least invasive treatments, moving through more invasive therapeutic management treatments. Explain to the patient, you are going to be their partner, their advocate in this. You will act as their liaison with their physician to relay any necessary information, changes in therapy, and progress. In addition to that, explain to them that you have at your resource pool referrals for physical therapists, for medication devices. Explain to the patient that you have resources to assist them, whether that be referrals for physical therapists, the devices that go along with the protocol, or, if necessary, referring back for surgical interventions. Once you get the patient's attention with this and you explain exactly what the protocol does, they will see that you're there as a compassionate caregiver, that you are going to partner with them and help them. The patient buy-in comes from the fact that they now have someone who is listening and who is acting on their behalf proactively to really get them the best outcomes. Once you get to this point, the patient's going to understand. Explain to them you are going to make a referral to their physician and ask for permission to proceed with the protocol. Once you have done that, you reach back out and set up your initial consultative appointment with the patient so that they are comfortable and understand that you're going to take care of them in a way that they probably have never seen. If you have more questions about how to implement the Stanley Penile Rehabilitation Protocol for your patients in your practice, please visit us at our website, stanleypharmagroup.com. Thanks.